Hi friends, welcome back to one of the most awaited video, that is tips to pass MFDS Part 2 exam. So in this video I'll be discussing about the golden tips to pass MFDS Part 2 exam, the various colleges that conduct this exam and what are the differences between them, how to prepare for your OSCEs, how to present them in the best possible way, and what all you need to study to pass this exam, that is about the study material. And also finally, a small surprise for you all, so keep watching. So just a bit about myself. My name is Dr. Mahwesh Naaz Khan. I am a dentist and I reside in UK. I absolutely love everything about dentistry. That's the reason I have created this channel called as Meet Your Teeth, wherein my focus is on two groups mainly. Firstly, to the general public, I prepare some videos about the common dental problems and how to prevent them, just to create some more awareness about the dental problems. And secondly, to guide my dental students who wish to pursue dentistry in UK, I prepare some videos on how they can pursue dentistry in UK and about the various exams. So if you're interested, please go through our past videos. Hope you find them useful. Okay, so let's begin. What exactly do you need to pass MFDS Part 2 exam? Firstly, good communication skills. Absolutely important, because this exam is all about interacting with the patient. You will have OSCEs in which you will have an active patient. That's it really. So just talk. As such, you won't be doing anything. It's all about how you explain the problem to the patient or discuss their concerns. So this has to be really improved, and this is something that you will learn with practice. Secondly, a lot of empathy is needed. Now, this is something that we are not actually trained to express many times. So for example, I'll tell you, if the patient tells that they have got pain in one of the front tooth, so the first thing you say is, I'm really sorry to hear about the pain that you're suffering from, but please don't worry, I'll do my best to sort it out for you. Okay, how does that sound? Rather than you just say, okay, where is the pain? So this is something that we actually need to include in every OSCE. Thirdly, sound clinical knowledge. So you really need to have strong basics. If not, it's very difficult to work around the OSCEs. Then up to date with the latest UK guidelines. Now, these keep changing every 2-3 years, so you need to make sure that you're studying the latest guidelines about the various dosage or the rules that keep on changing. Okay, I'll be discussing about this in detail in a while. Then confidence, really important again, because if you don't believe in what you are saying, how will you make your patient believe in it, right? Now, I would say never mug up your OSCEs, because this should just come out spontaneously rather than thinking what is the next thing, what was the next line that you had to talk about. It is something that you just have to learn. So I would say understand the scenario well rather than just mugging up the OSCEs. Then lastly, timing your OSCEs is really important. Let's say you have got 10 minutes for each station. If you keep on talking and just on one topic, you will miss your marks for the rest of the topics that you had to discuss. So make sure that you finish your OSCEs at least 2 to 3 minutes before, because in the exam there'll be a lot of clinical pictures or x-rays or reports that you might have to discuss. So this is one of the common questions that students normally ask. Because this exam is conducted by 3 different colleges like England, Edinburgh and Glasgow, students ask like which college they should take up this exam. As such, all of these are RCS exams, so it doesn't really matter. All of them carry the same value and recognition. However, because there are different colleges, there are few differences in them. So based upon these changes, you can decide which from which college you want to appear. So for example, in the venue, Edinburgh is conducting this exam face-to-face, so you need to be present there in the RCS Edinburgh College to appear for this, whereas England was conducting it online until now. Coming to the fees, there is slight difference, again, not much. I have also discussed about this in the previous video, which I'll be sharing the link in the description box below as well. So basically part 1 is about £540 and part 2 is about £650 to £700. Coming to the number of OSCEs, Edinburgh has 10 OSCEs along with the rest stations, whereas England has 14 OSCEs. About the assessment pattern, now this is a bit different, so you need to make sure that you prepare according to the college that you are preparing for. For example, England exam marks you on 6 domains for each OSCE. Let me tell you what are those domains. So for every OSCE, you will be marked on the following, that is applied clinical knowledge, communication skills, diagnosis, information gathering, information imparting, investigations, and management. So this is also present on the mfdsengland.co.uk website. You can go through it in detail. They've also posted some examples on how you will be marked for every OSCE. Whereas the Edinburgh College marks you on 4 themes. So they've got 4 themes for every, they divide the 10 OSCEs among these 4 themes. So let's see what are those 4 themes. History taking, so you'll have 2 stations about history taking, 4 stations for explanation, that is explaining about the diagnosis, prognosis, or treatment options or the procedure. Then 1 station about interpretation of the investigations or special test, and then 3 stations for managing patient concerns or queries. That can be about gaining consent, handling complaints, managing anxiety, motivating, or breaking bad news. Again, all this is also mentioned on the RCS Edinburgh.ac.uk website, so you can go through it. So I would say keep an eye on the respective colleges' websites because things can keep changing. So before you apply, just go through them. So as I mentioned, this exam is all about OSCEs, so you need to definitely master your OSCEs. It's a postgraduate diploma exam. It's a higher qualification apart from BDS. So in every OSCE, basically, you have to prove that you are capable of handling the patient in the best possible way. So my advice is always be a safe dentist. And always think ahead. So gather as much relevant information from the patient as possible and then plan your treatment accordingly. For example, let's say that there is a patient who is very much keen to have an implant, and let's say you forget to ask about the medical conditions like diabetes or any habits like smoking or not, and then just explain the treatment for implants. That means you are missing on a very important point. If he comes out to be a smoker, that means the success rate of implants for smokers is quite reduced. So you need to make sure that you ask the relevant questions and address the problems accordingly. Talking about the patterns of OSCEs, now they differ a bit depending upon the college, although this is not clearly mentioned on their websites as such, but this is something that we understood over the period of time through experience, that there are a few differences. So the Edinburgh College mainly has actor OSCEs, and sometimes there could be medical emergency scenarios. Whereas in the England exam, there are a mixture of actor OSCEs as well as SCRs, which is structured clinical reasoning stations, wherein instead of actor patient, you will have an examiner who will ask you few viva questions. It can be anything based upon some clinical pictures or x-rays. So it's like a viva wherein there'll be multiple questions that will be asked. So just a definition of OSCE, what exactly OSCE is. It's an objective structured clinical examination which is designed to test your clinical competence by assessing your communication skills and your knowledge, understanding, and management of a range of common conditions. Okay, so what's the way to present the OSCEs? Now, for every OSCE, you will have to consider the following factors, such as, firstly addressing the patient's main concern. Why is the patient here today? You need to address that first, and then if you have time, at the end of the OSCE, you can quickly discuss about any secondary findings that you see in the X-ray or in the clinical pictures. Then always ask about the medical history questions, just the relevant ones at least, like if they have got any allergies, if they are taking any medications, any medical problems, if they are under control or not, and any hospitalization in the past. Then asking about the habits such as smoking, alcohol, about the diet, high sugary diet or acidic diet, any teeth grinding habit, because all these will impact the treatment that we give. Giving the treatment options, you will have to give all the treatment options, starting from the simplest to the complex ones, and at least 1 or 2 advantages and disadvantages for each of the option that you're giving. Now, when you are explaining this, you have to make sure that you take into consideration the patient's medical condition or the habits, because that will influence the treatment. Make sure to ask if the patient has got any time or financial constraints, because again, depending upon this, the preference for the treatment will differ. And then giving the preventive advice. Now, this is a small part which many of us will miss during the OSCEs, but it's really, really important, because if you see in dentistry, most of the treatments that we do need to be need to be taken care of. So our aim is always to firstly treat the patient and then empower them to maintain that treatment for as long as possible. So preventive advice is really important. Finally, recall the patient. Depending upon the NICE guidelines, you'll have to recall the patient for every 3 months, 6 months, or once every year, depending upon the condition. Okay, so I believe that until now, you might have got some idea on how you should be presenting your OSCEs. Now let's see what exactly you should be studying for this. Before I move on, now if you see online, there's a hell lot of information available about the lengthy list and things that you should be studying to pass this exam. As such, I'll tell you what, through my personal experience, that this is a beautiful exam. It makes you a better dentist, and when you start studying, you will actually realize that it opens up your thoughts and it just makes you think more. Definitely improves your knowledge. There's a lot of information that you can study, but what I will be saying is at least the basic ones that you should definitely study to smoothly pass the exam. The most important study material will be the past questions, because many a times the scenarios will be repeated, more or less the same. So there are a lot of notes available online through various tutors or past students who can provide you with this happily. And lots are already circulating on social media, so you can easily find them. The ones which I absolutely liked was MFDS booklet. So it's a selection of, I think, about 100 OSCEs or more than that. It covers up all the topics. So it's really nicely written. And if you can get hold of it, that will be great, because it covers up almost all of the OSCEs. There might be some new ones which you will come to know when you start revising, but at least it covers all the basic ones. Also, you can go through Kathleen Fan, which is again a book that includes the past OSCEs. Then the UK guidelines, the latest ones, which I just discussed. In the next slide, I'll be talking in detail on what exactly the topics that you need to study, because there are so many guidelines, you won't be going through all of them, but at least the important ones. Then Pink Book, which is Oxford Handbook of Clinical Dentistry. Although it's a small one, but believe me, every line of this book is packed with so much of useful information. So always keep this book handy. This will make your basics strong. So if you have any doubts, you can always refer to this. And then there is a book called as Clinical Problems in Dentistry, which is mainly focused on MFDS OSCEs by John Lanslow. I came to know about this through one of my friend, and when you actually see this book, it's like a thick book. But when you start studying or start reading it, believe me, you will feel like that this book is actually talking to you. So you will definitely enjoy reading it. Every OSCE is so beautifully written. You will definitely enjoy the OSCEs and you will retain those in your mind for a long time. So please make sure that you go through these. This is the list of guidelines or documents which you will need to study. Let me tell you that this is not an exhaustive list. So depending upon the OSCEs, once you start studying, you will understand if you need to go through any other guidelines as well, right? So starting with the TMJ management, this is mentioned on the RCS clinical guidelines if you see on the RCS website. Even the trigeminal neuralgia management is mentioned on the RCS website. Then Delivering Better Oral Health by Public Health England, which is a really important document. Make sure that you go through each and every page of this. Radiation guidelines about the selection criteria and about the radiation protection by FGDP. Infection control guidelines through the BDA advice sheets. The trauma guidelines, very, very important, because many times there'll be a lot of scenarios about the pedo patients, that is deciduous teeth trauma or permanent teeth trauma. So you have to make sure that you're thorough with the trauma guidelines. Wisdom tooth extraction guidelines by NICE. Unerupted canines, extraction of first permanent molars through RCS again. Management of medicine-related osteonecrosis of the jaw guidelines through SCDEP. Then management of patients taking anticoagulants again through SCDEP. Statutory duty of contour, which is a really important article. Please make sure that you go through it. This in itself is one of the OSCE that might come in the exam. Orthodontics, for this you can read all the patient leaflets which are mentioned on the BOS, which is British Orthodontic Society. So if you go through these leaflets, you will cover most of the orthodontic cases. Then Young Practitioner's Guide to Periodontology, BSP New Periodontitis Classification, really important because at least there'll be 1 to 2 perio OSCEs in the exam. Teeth whitening, anxiety management guidelines like sedation, general anesthesia, then amalgam toxicity, impacted canine guidelines, orointral fistula, consent, data protection. Please make sure that you read the BDA advice sheets. Marketing, again BDA advice sheet. Chemotherapy, radiotherapy guidelines present on the RCS website, and antibiotic guidelines again on the RCS website, and finally handling complaints. Also, I did a video on study material for part 1 exam in which I've also mentioned a few more guidelines. So if you want to go through that, if you're interested, you can go through that. All right, so you understood how to present the OSCEs, what all things you will need to study. Now, the last thing that you require is to find a good study partner. As I mentioned, this exam requires you to talk, to explain, to understand the patient, to demonstrate your knowledge. So having a good study partner is a must, with whom you can, share knowledge, practice OSCEs, which will improve your communication, critical thinking, give honest feedback to each other, correct your mistakes, and the one who can be punctual with time and at times when needed, motivate each other. So having a nice study partner is something really important for this exam. Okay, so that's a little surprise for you all. From this month onwards, I'm going to start MFDS 2 Kickstart courses. I had promised this quite a long time ago, but sorry, because of my busy schedule, because I'm working full-time, I could not start this any earlier. But anyways, I'm all set now. So these will be very affordable, of a very high quality, very well organized courses. Whether you're a beginner or you just wish to have revision, I think this is the course that will definitely benefit you. So if you're interested, you can get in touch. So let me quickly discuss how this will work out. Depending upon the need of the student, I can discuss the OSCEs in detail or conduct a mock for students who are well prepared and would like to have a revision. I will do it online, possibly through Zoom or Teams, and then I will share any presentations or pictures relevant to the OSCEs, and I'll make sure that I design such courses to be as interactive as possible. So of course, when you enroll in my course, you'll get all of my support through email or through WhatsApp. I will make sure that I address all your inquiries, all your doubts, and guide you on what you need to study. Definitely, when you take this course, I will be giving you individual feedback on where you need to improve, because that is what is needed to pass the exam. So if this sounds interesting to you, for more information, please contact me on my various social media platforms. The links of all these groups will be attached in the description box below, and I shall do my best to respond to your messages as soon as possible. But nowadays I'm getting so many inquiries, so I might take a while to respond to you, but please be rest assured I will respond. Okay, so that's it for today. Thanks for watching. I hope to be back next time with another interesting video. Until then, take care and good luck for the future.